And welcome, everyone, to the Healthcare Secrets Podcast. I'm John Daly, along with my partner here, Judd Anglin. Hey, Judd.
Hey, John. How are you doing today?
Hey, I am doing great. This is real exciting. This is our first podcast. Let's get into a couple of things here, because we're going to give you the secrets that the healthcare industry doesn't want you to know. Through our years of research and reporting, we know that the majority of the healthcare industry is more concerned about profits rather than your health. We're going to cover that and provide you the solutions to get healthier and also to get wealthier and save you money. Now, folks, you can find out more about Judd and me on our website, which is the healthcaresecretspodcast.com. Please subscribe to the site. Now, I want us to get some content here, Judd, rather than talking about how great we are, because we are. Judd's book is called The Big Book of Healthcare Secrets. Again, you can get that on the website, and this is a fabulous book. It's also one of the foundations of this podcast here. So, Judd, let's give them a glimpse of the book and future podcasts. What would you say is the biggest healthcare secret people could actually latch onto right now?
Great question, John. And that's a difficult one, actually, because there's so many secrets that people just don't know about. But one that I like to give out to people that I talk to is the Surgical Center of Oklahoma. Now, you can get on your Google browser or whatever browser you have and type in the name Surgical Center of Oklahoma and bring it up. And what you're going to find is on the top left tab on their homepage is a pricing tab. So you simply click on that and you're going to be amazed, because it's going to bring a map of the human body with all these dots on it. You click on the dot based on whatever procedure you need. So, for example, if you need a hip replacement, you can click on the hip and it'll bring it up, and it'll bring all the procedures up related to that procedure or to that hip area. And what they list is the actual bundle price. That's the total price that you're going to pay. And what you're going to find is that it's going to be about 1/5 to 1/6 the cost of your local hospital.
Wow. Well, and you know what's fascinating, we're going to get into medical tourism because you're the expert on that as well. And I've been in Malaysia, you've been in Malaysia, and when you go to those hospitals there and you actually go look at their costs are actually put on the wall. You can actually look at them. This is what you're going to pay for this. This is what you're going to pay for that. This is what the doctor's going to charge you for his services. And it's kind of like, why can't we do that here? And Oklahoma does do it. The Oklahoma Surgical Center does do that.
What a novel idea, yeah, to actually list price of a procedure.
Yeah, so we all know it. You can be competitive, and we can go out and find other competing prices as well. Now, we should also point out, you've been down there, and we should also point out that we are not being paid to talk about the Oklahoma Surgical Center. Explain that and what the doctor down there said to you.
Yeah, absolutely, John. The founder of the Oklahoma Surgical Center is Dr. Keith Smith. He's a friend of mine. And I approached him several years, when I was facilitating affordable treatment abroad through MedRetreat. I gave him a call and said, hey, I would like to add you as an affiliate partner and promote your center. And, he very nice guy. And he said in a very nice manner, it's like, Judd, I totally appreciate it, and I would love to be a part of it, but we simply don't have the margins, because we save our patients so much money that I don't want to start building cost into that. I want to keep it extremely as low as possible.
Wow. All right, let's talk about another solution here, medical cost sharing. Now, you and I are both members of Liberty Healthshare, and this has been a life changer for me and my family. Let me explain it to you really quickly here. It's not insurance. It's people coming together to agree to share each other's medical bills under a certain set of guidelines. And this is allowable under the Affordable Care Act. Now, if you take the insurance theory, which is called the law of large numbers, medical cost sharing works brilliantly with this. If you get enough people together, like about 300 people, you can literally take care of everybody's medical bills while keeping them low. Now, if you get rid of the high administrative costs that the insurance companies have and the profits they have to pay their shareholders, then you can see some massive drops in healthcare costs. Plus, it makes healthcare more competitive, and you control your own healthcare because you're a self-pay patient. Again, I said it's done wonders for me and my family. What's it done for you, Judd?
First of all, very well said, John. Great explanation. It's been wonders for my family. First and foremost, is that it's a lot more affordable. I'm amazed by how how much more affordable it is to other solutions out there. But I have to say that it works. The thing I like the most about it, I think it's even better than insurance actually, because there's no network involved. With typical insurance, they dictate which hospital, which doctor you can see, and if not, then you're penalized or you have to pay for it. But with Liberty Healthshare, you can literally use it anywhere in the world. So, for example, if you're traveling in Europe or Asia and you're sick, you go to the hospital, all you have to do is get the bill in English and present that bill to Liberty Healthshare, and they'll pay it, which is absolutely fantastic.
Well, exactly. And, I talk about it on my other show, Undercover Jet Setter, with my co-host Susan Anzalone, and we do travel, food, wine, and golf. But one of the things we really push for travelers is Liberty Healthshare, because it's a healthcare system that actually goes with you wherever you travel, whereas most of the insurance companies, they're not going to, or they're going to soak you if you have anything that happens to you when you're outside there. Now, we should also say, you and I are not getting paid by Liberty Healthshare either. However, we are certified by Liberty Healthshare to offer you guys memberships as well. So we can talk about that, and we'll get people on from Liberty Healthshare to explain it even further. Also, as you're going to see in our backgrounds, we've spent a lot of time in the healthcare industry. We're also avid readers. We're avid talkers when it comes to healthcare issues. So we're going to bring you many other books and authors in addition to Judd. And one of the reasons is the world is changing drastically, and it's changing quickly. Artificial intelligence, blockchain, those things are going to affect your healthcare. So we're going to stay on top of that too. And this is what you and I love doing too, Judd.
Absolutely, John. It's we're just going, like you said, we're going through massive transformations in our culture, in our society, with all the new technology. The social media applications, and like you said, artificial intelligence. That sometimes it's hard to make sense of things, but it's important, for Americans to understand the implications of all these and have discussions about them and make sure that they're the right way to go and really help people in understanding what's going on, but at the same time be able to drill down and apply all this information to healthcare, great healthcare at a very affordable price. Yeah,
and we're going to bring the experts on. We're also going to call out people. We're going to call out organizations. Is everybody bad in healthcare? No, they're not. There's actually some really good things going on there. Is everybody in Congress or in the federal government bad as far as healthcare goes? No, but there's a lot of them that are clueless, and there's a lot of them who are being paid because of special interest dollars. We're going to call them out as well. So what we're looking for is your feedback. So if you go to the website, which is the healthcaresecretspodcast.com, you can sign up to subscribe. Give us your suggestions, your topics, your questions. We're also going to have a Facebook page under the same name as well as a Twitter site. So you can definitely join us. So, Judd, I don't know about you, but I'm really pumped and excited because I don't think a lot of people are talking about this, and the fact that we've got the ability to bring them these what we call secrets and get it off to them. I'm really excited.
John, I echo your sentiments 1,000%. I'm very excited as well because I've known about these solutions for years, even when we were doing the healthcare reform debates back in the Obama's early administration. And we kept hearing all these pundits on TV and all over the places saying that, we've tried these things and they don't work. And I would scream at my TV because I'm like, my gosh, they do work. They are working. Why can't you talk about these things? And you know what? That's what we're going to do with this. We're going to show you things that are working, and we're going to have fun doing it. And we look forward to having you on and following us. Thank you for joining.
Absolutely. And folks, thanks for being here. And remember, our phrase is get healthy and get wealthy. So we're going to follow that. We'll catch you on the next podcast.